Seniors. You're taking vitamin B12 the wrong way, doctor explains. If you are a senior, specifically over the age of 60, and you diligently incorporate vitamin B12 into your daily regimen, it is imperative that you pause for a moment and absorb this crucial information as it addresses a pervasive issue frequently encountered in clinical practice. It is remarkably common to hear patients articulate their frustration almost every week, posing questions like, "Doctor, I meticulously take my B12 supplement every single day, yet I continue to grapple with persistent fatigue, pervasive brain fog, unsettling dizziness, or even the disconcerting sensation of numbness and tingling in my hands and feet. Why is this happening?" This very sentiment was recently echoed by a 68-year-old patient who had been taking vitamin B12 consistently for more than 7 years. Despite his blood tests presenting seemingly normal B12 levels, he reported a noticeable and distressing decline in his overall energy, a troubling sense of imbalance, and an undeniable worsening of his memory capabilities. What truly astonished him, and indeed many others, was the revelation that his problem was not a deficiency of vitamin B12 itself. Rather, he was inadvertently taking it in an ineffective manner. Emerging new research conclusively demonstrates that a very prevalent mistake concerning B12 supplementation, particularly observed in adults aged 60 and above, can severely impede its absorption into the body and silently inflict damage upon crucial nerve function over time. As Dr. from Michael Kent, my purpose in this comprehensive explanation is to meticulously elucidate this critical mistake, shed light on why it is so frequently overlooked by most medical professionals, and ultimately provide a clear, actionable guide on how to correctly take vitamin B12 so that it genuinely provides robust support for your brain health, vital nerve function, and sustains your long-term energy levels. Many individuals harbor the erroneous belief that if their routine blood test indicates a normal B12 level, then their B12 status must be perfectly adequate and all is well. However, for adults who have crossed the threshold of 60 years, this assumption is alarmingly often incorrect and can lead to prolonged suffering. Vitamin B12 is an absolutely indispensable nutrient, playing a pivotal role in maintaining optimal nerve function, supporting robust brain health, facilitating the production of healthy red blood cells, and efficiently regulating energy metabolism throughout the body. Without a sufficient supply of usable B12, the intricate network of nerves begins to malfunction, leading to a cascade of early symptoms that often manifest as tingling sensations in the extremities, hands and feet, debilitating balance problems, overwhelming fatigue, concerning memory lapses, and the characteristic cloudiness of brain fog. The core of the problem lies in the natural aging process itself. As we advance in years, our body's inherent capacity to absorb vitamin B12 from both food and supplements undergoes a sharp and significant decline. By the age of 60, it is estimated that more than half of all adults experience a substantial reduction in stomach acid production. This stomach acid is absolutely essential, acting as a critical catalyst to separate vitamin B12 from its binding proteins in food and to release it effectively from supplements, making it available for absorption. Consequently, without an adequate amount of this vital acid, B12 can simply pass through the digestive system unused, offering no benefit whatsoever to the body. This phenomenon was starkly evident in one of my patients, Margaret, a 71-year-old woman who presented with distressing complaints of persistent burning sensations in her feet and frequent disorienting episodes of dizziness. Her primary care physician had indeed checked her B12 level, which returned at 420 picograms per milliliter, a figure technically considered within the normal range. She was reassuringly told that nothing was amiss, yet her debilitating symptoms inexorably continued to progress and worsen. What most people, including many healthcare providers, fail to grasp is that a standard blood B12 test merely indicates how much B12 is currently circulating in your bloodstream. It does not provide any insight into how much of that B12 is actually entering and being utilized by your cells, particularly your nerve cells. In older adults, it is a common paradox for B12 levels to appear normal in blood tests while their nerves are, in reality, silently starving for this essential nutrient. This explains precisely why so many seniors conscientiously take B12 supplements for years on end without experiencing any noticeable improvement in their symptoms, leading to understandable frustration and disillusionment. It is at this juncture that the first major and pervasive mistake in B12 supplementation commonly occurs. The vast majority of seniors typically take vitamin B12 in the form of a standard tablet, which they simply swallow with water, assuming it will be absorbed in the same straightforward manner as any other vitamin. However, for individuals over the age of 60, this conventional oral tablet form is frequently ineffective. The efficient absorption of B12 is critically dependent on a specialized protein known as intrinsic factor, which is diligently produced in the stomach. As we age, the production of this vital intrinsic factor naturally declines. Without sufficient intrinsic factor, swallowed B12 tablets are very poorly absorbed, often passing through the body with minimal benefit. This issue is not an anomaly. It is an extremely common physiological change associated with aging. The 68-year-old patient I referenced earlier, for instance, had been taking his B12 precisely as instructed every morning, maintaining the same dose and brand for years, yet his nerve health continued to deteriorate. A pivotal change occurred when we adjusted the form of B12 he was taking, rather than merely increasing the dose. Within a matter of weeks, his symptoms began to show clear signs of improvement. This compelling outcome underscores why the form of vitamin B12, meaning its delivery mechanism, holds just as much importance as the amount or dosage. Moving on, let us address the second common mistake, which is also alarmingly widespread. Many individuals are unknowingly taking the wrong form of B12. If you examine the labels of most B12 supplements readily available on store shelves, you will repeatedly encounter one specific name, cyanocobalamin. While it is an inexpensive and highly stable compound, cyanocobalamin is, unfortunately, the least effective form of B12 for older adults. Cyanocobalamin is a synthetic compound. Your body cannot directly utilize it and must first undergo a complex conversion process to transform it into an active form of B12 before it can become biologically available. This vital conversion process requires healthy liver function, optimal enzyme activity, and adequate antioxidant capacity, all physiological functions that frequently slow down or become compromised in adults over 60. I witnessed this firsthand with a patient named Robert, age 72, who had been taking cyanocobalamin for many years. His blood levels appeared acceptable, yet he continued to suffer from persistent numbness in his fingers and increasing difficulty with walking and maintaining his balance. When we transitioned him to methylcobalamin, which is a naturally active and readily usable form of B12, the transformation was truly remarkable and immediately noticeable. Within just 1 month, his balance significantly improved, and within 3 months, the numbness in his fingers had substantially decreased. Extensive research consistently shows that active forms of B12, such as methylcobalamin and adenosylcobalamin, are absorbed and utilized far more efficiently and effectively in older adults, bypassing the need for a potentially compromised conversion pathway. Another critical yet frequently overlooked issue pertains to dosage timing. Many seniors believe that taking B12 once in the morning is sufficient to meet their needs. However, vitamin B12 is a water-soluble vitamin, meaning it is quickly processed and cleared from the bloodstream. In individuals who already experience absorption issues, a single daily dose may simply not provide adequately sustained therapeutic levels of B12 required for continuous nerve repair and regeneration. Furthermore, there exists a dangerous misunderstanding surrounding B12 injections. Some individuals are led to believe that B12 injections represent the only viable solution for deficiency. In reality, while injections are undeniably beneficial and often necessary in cases of severe B12 deficiency, they are not universally required for all seniors. High-quality sublingual B12 supplements, when taken correctly, can be just as efficacious for many older adults. Sublingual forms are specifically designed to bypass the stomach entirely, thereby circumventing the challenges associated with stomach acid and intrinsic factor production. Instead, they allow for direct absorption of B12 through the rich network of oral tissues under the tongue, delivering it directly into the bloodstream. This method of delivery is particularly advantageous and crucial for adults who suffer from low stomach acid or various other digestive issues that impair conventional absorption. The fundamental lesson here is unequivocally clear. If you are over 60, simply swallowing a standard B12 tablet may indeed provide you with normal lab numbers on paper, but it may very well fail to adequately protect and support the health of your vital nerves. Now, we arrive at the third mistake, one that tends to surprise most seniors because it has absolutely nothing to do with the dosage amount or the form of B12 taken. Instead, it revolves entirely around timing and consistency. Many individuals approach vitamin B12 supplementation in an erratic manner, taking it only when they perceive themselves to be tired, skipping days intermittently, or discontinuing it entirely once their symptoms show a slight improvement, only to restart weeks later when symptoms inevitably resurface. This intermittent approach fundamentally misunderstands the nature of nerve tissue healing. Vitamin B12 is not a quick-acting stimulant that provides an immediate energy boost. Rather, it is a crucial repair nutrient. Your nerves require a steady, uninterrupted, and consistent daily availability of B12 to actively rebuild damaged myelin, which is the protective, insulating coating that surrounds and shields nerve fibers. Intermittent dosing severely disrupts this intricate and ongoing repair process, making sustained recovery impossible. I observed this detrimental pattern in Elaine, a 70-year-old patient who would only take her B12 supplement on days when she felt profoundly exhausted. On those specific days, she reported feeling marginally better, but her underlying numbness, persistent balance issues, and concerning memory problems never showed any substantial or lasting improvement. It was only when she committed to taking B12 consistently every single day without skipping a single dose that her symptoms began to stabilize and, over time, gradually improve. After just 2 months of consistent daily intake, the progression of her tingling sensations halted, and after 4 months, her balance had remarkably improved. Another frequently overlooked issue is the timing of B12 intake within the day. Many seniors mistakenly take B12 late at night. For some individuals, this can inadvertently interfere with their sleep patterns, leading to restless nights. Poor sleep, in turn, elevates cortisol levels, increases systemic inflammation throughout the body, and critically slows down the already delicate process of nerve repair. For the vast majority of seniors, the optimal time to take B12 is earlier in the day, ideally in the morning or early afternoon. This timing effectively supports daytime energy levels and nerve function without the risk of disrupting precious nighttime sleep. Hydration also plays a far more significant role than most people realize. Vitamin B12 performs its vital functions inside cells, which are heavily reliant on maintaining proper fluid balance. Chronic mild dehydration, an unfortunately common condition among older adults, directly reduces the efficient transport of essential nutrients, including B12, into nerve tissue, severely limiting its effectiveness. Therefore, if you are diligently taking B12 but rarely consume adequate amounts of water throughout the day, your results will undoubtedly be suboptimal. Finally, it is crucial to acknowledge that many seniors are taking prescription medications that can directly interfere with either B12 absorption or its proper function within the body. These commonly include acid blockers, such as proton pump inhibitors, metformin, a medication for diabetes, and certain types of antibiotics. This information is not an instruction to abruptly discontinue your prescribed medications. Rather, it signifies that you must adjust your strategy for supporting your B12 levels and potentially discuss these interactions with your doctor. By this point, a critically important realization should be dawning upon you. Most seniors are not merely making one isolated mistake with their B12 supplementation. Instead, they are simultaneously making several small, seemingly innocuous errors. Each individual mistake, on its own, may only marginally reduce the therapeutic benefit, but when compounded together, these multiple errors can collectively and completely cancel out the positive effects of vitamin B12, rendering the supplement virtually useless. Let me now guide you through the precise and correct vitamin B12 protocol, specifically tailored for seniors. This is the evidence-based approach that I consistently employ with my own patients who are over the age of 60 to ensure they derive maximum benefit. First, let us definitively address the form of B12. For the vast majority of seniors, the absolute best choices are methylcobalamin or a thoughtful combination of methylcobalamin and adenosylcobalamin. These are both active, bioavailable forms of B12, meaning your body can immediately utilize them without requiring any complex and potentially impaired conversion processes. It is vital to avoid relying solely on cyanocobalamin, especially if you are experiencing any concerning nerve-related symptoms. Second, the delivery method is paramount. If you are over 60, simply swallowing a standard B12 tablet is, as we have discussed, often insufficient for effective absorption. Sublingual B12, which is placed under the tongue and allowed to slowly dissolve, masterfully bypasses many of the common absorption problems encountered in the stomach. This simple change in delivery method alone can dramatically enhance your results and lead to noticeable improvements. Third, regarding the dosage, specifically for nerve and brain support in seniors, it is a common misconception that low doses are adequate. In fact, low doses often fail to produce meaningful results in older adults. Most seniors require higher amounts to effectively overcome the age-related absorption barriers. A commonly effective and well-tolerated daily range is between 1,000 to 2,000 micrograms. Some individuals may even require a higher initial dose to address long-standing deficiencies or significant nerve damage, which can then be reduced for maintenance once symptoms improve. This higher dosage is not dangerous, as vitamin B12 is water-soluble, and any excess amounts are safely and naturally excreted from the body. Fourth, consistency is non-negotiable. B12 must be taken diligently every single day. Not just occasionally, and certainly not only when you feel fatigued. Nerve repair is a slow, gradual, and intricate biological process. Symptoms typically improve incrementally over a period of weeks to several months, not instantaneously overnight. Fifth, timing. Your dose can make a difference. For most seniors, taking B12 in the morning or early afternoon is ideal. This timing strategically supports daytime energy levels and nerve function, while simultaneously reducing the risk of any sleep disruption. If B12 makes you feel particularly alert or energized, it is best to avoid taking it late in the evening. Sixth, supportive nutrients are often essential cofactors. Vitamin B12 does not operate in isolation. It works synergistically with other vital nutrients. Folate, preferably natural folate or methylfolate, with caution exercised regarding high-dose folic acid, and vitamin B6 are frequently needed to provide comprehensive nerve support. Seventh, monitoring progress should extend beyond mere lab tests. While blood tests offer some insight, it is crucial to pay close attention to your actual symptoms and how your body responds over time. Are the sensations of numbness in your hands diminishing? Is your balance perceptibly improving? Is your thinking becoming clearer and sharper? These tangible symptomatic changes hold far greater significance and reveal more about your real health status than a single number on a laboratory report. I recall a 75-year-old patient who meticulously followed this exact comprehensive protocol. After 3 months, her lab values had only shifted slightly, but her walking significantly improved. Her troubling falls ceased entirely, and her confidence in her physical abilities remarkably returned. That is the true measure of success. At this juncture, it is critically important to grasp one fundamental truth. While vitamin B12 is undeniably powerful and essential, it is not a magical cure-all. There are specific situations where B12 alone, even when taken correctly, will not fully resolve all symptoms. One of the most prevalent challenges is long-standing nerve damage. If nerve compression, spinal degeneration, or the insidious effects of diabetes have been present and progressing for many years, B12 can certainly support and facilitate the repair process, but it cannot miraculously reverse severe structural damage overnight. Another frequently overlooked factor is blood sugar control. Chronically elevated blood sugar levels directly inflict damage upon nerves. In seniors living with prediabetes or full-blown diabetes, nerve symptoms may stubbornly persist unless glucose levels are actively and effectively managed. Inflammation represents yet another silent blocker of B12's efficacy. Chronic systemic inflammation interferes profoundly with nerve signaling and obstructs the efficient delivery of essential nutrients to nerve tissue. Factors such as poor sleep hygiene, chronic stress, and sedentary lifestyle habits all contribute to elevated inflammatory markers within the body. If these underlying issues are left unaddressed, B12 is forced to work much harder and consequently delivers far less benefit. There is also the crucial issue of misdiagnosis. It is imperative to understand that not all instances of numbness, tingling, or weakness are exclusively caused by B12 deficiency. Other medical conditions, such as cervical spine compression, a pinched nerve in the neck, carpal tunnel syndrome, and various forms of peripheral neuropathy stemming from other causes, can strikingly mimic B12-related symptoms. This is precisely why any persistent or worsening symptoms should always prompt a thorough evaluation by a qualified medical professional. It is dangerous and ill-advised to assume that simply taking more supplements will invariably solve every problem. I want to share a quick illustrative example. A 73-year-old man presented to me utterly frustrated. He had, on his own initiative, doubled his B12 dose after reading online advice, yet his symptoms showed no improvement whatsoever. Further clinical evaluation painstakingly revealed a diagnosis of spinal stenosis, a condition where his nerves were being physically compressed within his spinal canal. No amount of B12, regardless of form or dose, could possibly rectify that mechanical issue. Once the correct diagnosis was established and appropriate treatment, which might have included physical therapy or surgery, was initiated, his B12 supplementation transformed from a disappointing endeavor into a truly supportive and beneficial component of his overall health strategy. Now, let us meticulously bring all these insights together into a clear, actionable, and comprehensive plan. If you are a senior over the age of 60 and you are currently taking vitamin B12, this is what genuinely matters most. First, unequivocally stop focusing solely on laboratory numbers. A normal B12 blood level on a lab report does not, by itself, guarantee healthy nerves or optimal brain function. Instead, prioritize and pay close attention to how you feel and how your body tangibly responds to supplementation over time. Second, use the right form of B12. Make an informed choice for an active, bioavailable form of B12, such as methylcobalamin or a synergistic combination of methylcobalamin and adenosylcobalamin. These specific forms do not rely on your body's potentially compromised conversion abilities and are demonstrably more effective in older adults. Third, choose the correct delivery method. If you are over 60, you must actively avoid relying solely on traditional swallowed tablets. Sublingual B12, designed to absorb directly through the oral tissues, allows for efficient absorption without depending on adequate stomach acid or sufficient intrinsic factor production. Fourth, take an effective dose. For the majority of seniors, a daily dosage of 1,000 to 2,000 micrograms is a reasonable and often effective starting range. Some individuals may initially require a higher dose to replete depleted stores and initiate repair, followed by a lower dose for ongoing maintenance. If you are uncertain about the appropriate dosage for your specific needs, it is always best to consult with your doctor. Fifth, be unequivocally consistent. Take your B12 supplement every single day without fail. Remember, nerve repair is a slow, steady, and continuous process, and skipping doses will interrupt this vital progress. Sixth, take it at the right time of day. For most individuals, morning or early afternoon works best, supporting daytime energy and cognitive function. Avoid taking B12 late at night if you find that it disrupts your sleep patterns. Seventh, actively support the overall process. This involves maintaining proper hydration by drinking adequate water, diligently managing your blood sugar levels, and proactively addressing issues related to sleep and stress. These foundational lifestyle factors are crucial determinants of whether B12 can actually reach and effectively nourish your nerves and brain tissue. Eighth, and finally, know when to look deeper. If your symptoms continue to worsen despite diligently following the correct B12 protocol, do not assume that B12 is the only answer. Seek a proper medical evaluation for potential nerve compression, underlying metabolic issues, or other causes that may be contributing to your symptoms. I want to articulate this point with utmost clarity. Vitamin B12, when taken the right way, possesses the remarkable potential to protect nerves, enhance memory, and significantly improve energy levels in many seniors. Conversely, when taken incorrectly, it can appear to do absolutely nothing, leading to frustration and continued suffering. The profound difference between these two outcomes is not a matter of mere luck. It is a direct consequence of understanding and applying the correct principles. Before we conclude, I wish to impart one final powerful thought. I once had a woman in her early 70s seek my assistance after years of resignedly believing that B12 simply did not work for her. When we meticulously reviewed her daily routine, it became evident that nothing she was doing was technically wrong in terms of contraindications, but critically, nothing was being done correctly, either in terms of optimization. She was using the wrong form of B12, habitually swallowing a tablet that her aging body struggled to absorb effectively, taking it inconsistently, and evaluating its success solely by impersonal lab numbers. With just a few simple, yet profound adjustments, specifically changing the form of B12, adopting a more effective delivery method, and committing to unwavering consistency, her experience was utterly transformed. 3 months later, she recounted something to me that I will genuinely never forget. With a newfound sense of joy and relief, she exclaimed, "Doctor, I feel steady again. I can truly trust my feet when I walk, and I no longer lose my words mid-sentence. It's like a part of me has returned." This poignant statement encapsulates the profound difference between merely taking a supplement and consciously using it correctly and strategically. If you are over 60, vitamin B12 is truly not an optional nutrient for maintaining your health and vitality. However, how you take it matters far more than most people currently realize. I earnestly encourage you to critically examine your current B12 routine tonight. Ask yourself one simple yet deeply insightful question. Is this current approach actually supporting my precious nerves and brain health, or am I merely going through the motions and just checking a box? Many seniors are unknowingly taking vitamin B12 in ways that render it ineffective, and they remain unaware of the simple changes that could profoundly impact their well-being. Remember, B12 is absolutely essential for thriving after 60, but only if you embrace the knowledge and commit to taking it correctly. Stay strong, stay healthy, and continue to seek out information that empowers you to live your best life.